Before hospitals, before pharmacies, before antibiotics, before x-rays, before surgery rooms, before anyone knew what a germ was, humans still got sick. They still coughed, they still bled, they still broke bones, they still gave birth, they still suffered fever, wounds, pain, infection, parasites, and fear. And somehow, they survived. Not always. Not safely. Not perfectly. But enough. Enough for thousands of generations to pass their bodies, memories, remedies, and warnings forward, until they eventually produced us. That is the strange thing about ancient medicine. Modern people often imagine the past as helpless. A person gets a fever, everyone panics, nothing can be done. But that is not true. Ancient humans did not have modern medicine. But they were never without medicine. They had plants, they had honey, they had fire, they had bandages, they had bone setting, they had fermented foods, they had healers, they had rituals, they had grandmothers who remembered which root helped pain and which leaf made it worse. They had thousands of years of trial and error stored not in books, but in human memory. So the real question is not, how did ancient humans survive without medicine? The real question is, what counted as medicine before science gave it a name? Imagine waking up in the deep past. Your throat burns, your head aches, your body is hot. There is no pill, no doctor, no clinic, no search engine, only the group, the landscape, and whatever knowledge your people carried from the dead. Someone brings water, someone brings a bitter plant, someone tells you to rest near the fire, someone watches through the night. Someone has seen this sickness before. That was medicine, not because it always worked, but because humans refused to do nothing. The first pharmacy was the natural world. Plants were everywhere, but not every plant helped. Some healed, some poisoned, some did nothing. Ancient humans learned the difference the hardest way possible. By watching, by tasting, by remembering, by surviving. A plant eased pain, another reduced swelling, another stopped stomach sickness, another made a wound worse, another killed someone. Every recovery became tradition. Every death became warning. This was not modern pharmacology, but it was observation. And observation repeated across generations becomes knowledge. Now move the map to Shanidar Cave in Iraq. Researchers found Neanderthal remains there, and for years people discussed the famous idea of a flower burial connected with medicinal plants. That interpretation is debated today. The pollen may not prove a deliberate medicinal burial, so we should be careful. But the broader truth remains powerful. Neanderthals and early humans were not stupid creatures wandering blindly through nature. They knew plants. They survived injuries. They cared for one another. They watched the world closely because the world could kill them. Once Homo sapiens spread across the planet, plant knowledge became one of our greatest survival tools. Willow bark was used in different traditions for pain and fever because it contains compounds related to aspirin. Garlic was used in ancient medicine and has real antimicrobial properties. Turmeric was used for inflammation and contains compounds still studied today. Not every ancient remedy worked. Some were useless, some were dangerous, but many were based on real effects noticed through experience. Ancient medicine was not nonsense. It was imperfect knowledge built from survival. Now think about wounds. In the ancient world, a wound was not a small problem. A deep cut from stone, an animal bite, a hunting injury, a fall, a spear wound, a childbirth tear. The injury itself could hurt, but infection could kill. There were no antibiotics, no sterile operating rooms, no modern stitches, no emergency care. So humans developed wound care from what they had. Honey was one of the most important examples. Ancient Egyptians used honey on wounds, and modern science confirms that honey can fight bacterial growth and support healing in some medical contexts. Honey is acidic. It has high sugar concentration. Some types produce small amounts of hydrogen peroxide. Ancient Egyptians did not know that chemistry, but they knew wounds treated with honey could heal better. That is ancient medicine at its best. Observation before explanation. Clay and mineral earths were also used in some traditions. Certain clays can have antimicrobial properties depending on their minerals. Fibers, leaves, bark, animal fat, ash, pressure, washing, and bandaging were all part of the ancient healer's world. People used the landscape as a medical kit. Then there is maggot therapy. It sounds disturbing, but it is real. Maggots can clean dead tissue from some infected wounds while leaving healthier tissue. Modern medicine still uses sterile medical larvae in controlled cases. Ancient people may have noticed that some wounds with maggots healed better than expected. Instead of looking away, they remembered. That is how survival knowledge grows. Now move to one of the most shocking parts of ancient medicine: surgery. Prehistoric people practiced trepanation, cutting or scraping holes into the skull, thousands of years ago. Some patients survived. We know this because the bone healed around the opening. Why did they do it? Maybe to treat head injuries, maybe to relieve pressure, maybe for seizures or severe pain, maybe for spiritual reasons. Ancient medicine and religion were often mixed together. But whatever the reason, the survival of some patients proves skill, care, and aftercare. Then move the map to Borneo. Archaeologists found evidence of a successful leg amputation from around 31,000 years ago. The person survived for years after the operation. That is extraordinary. Amputation is not just cutting. Bleeding must be controlled. Shock must be survived. Infection must be avoided. The patient must be fed, protected, cleaned, and supported while healing. That is not one healer acting alone. That is a community keeping someone alive. This may be the deepest truth about ancient medicine. The first hospital was the group. A sick person alone is vulnerable. A sick person with people nearby has a chance. Someone brings food, someone brings water, someone cleans the wound, someone keeps the fire alive, someone carries the injured, someone watches for danger, someone remembers what worked last time. Ancient medicine was social before it was scientific. Humans survived because they cared for each other. Now we must be honest. Ancient medicine had limits. Many infections were death sentences. A ruptured appendix could kill. Childbirth was dangerous. Dental infections could become fatal. Pneumonia could take a strong adult. A badly infected wound could end a life in days. Infant mortality was high. Many children never reached adulthood. Modern medicine changed everything. Antibiotics, vaccines, anesthesia, sterile surgery, blood transfusion, emergency care, and safe childbirth practices are among the greatest achievements in human history. We should never pretend the ancient world was better. It was not. It was harsher, riskier, and far less forgiving. But we should also not pretend ancient people were helpless. They were observant, creative, practical, brave, and deeply social. They built medicine from what they had: plants, honey, fire, fermentation, touch, memory, ritual, care. The immune system also played a role. Ancient bodies fought infection without knowing what infection was. Fever, clotting, inflammation, immune memory, and scar formation all existed long before humans could name them. Ancient healers often helped the body do what it was already trying to do: rest, warmth, water, food, wound cleaning, protection. These sound simple, but simple care can save lives. Fermented foods also mattered. Across the world, humans learned to ferment food and drink. Fermentation preserved food, changed taste, improved digestion, and introduced beneficial microbes. Ancient people did not know about gut bacteria, but they knew this food lasted longer. This drink felt safer. This sour thing helped the stomach. Again, the body noticed. The culture remembered. Then there was ritual. Modern people often dismiss ancient healing rituals as superstition. Some were. But ritual was not always useless. A trusted healer, a group gathered around the sick, a chant, a touch, a fire, a plant, a visible act of care. All of this could reduce fear and create hope. The placebo effect is real. Belief, expectation, and social support can change pain, stress, and recovery. Ritual could not cure everything. It could not replace surgery or antibiotics. But it could help the body fight by telling the mind, you are not alone. That matters. Now move through the first written medical traditions. In Egypt, the Ebers Papyrus recorded hundreds of remedies. In Mesopotamia, clay tablets listed symptoms and treatments. In India, the Sushruta tradition described surgical techniques. In Greece, Hippocratic medicine pushed the idea that disease could have natural causes. In China, medical traditions developed complex systems of herbs, diet, body theory, and treatment. Some ideas were right, some were wrong, but all of them show the same human instinct. When the body fails, humans search for an answer. That is the story of medicine. Not perfect truth from the beginning, but the refusal to leave suffering unexplained. So return to the sick person beside the fire. Someone brings a plant, someone cleans a wound, someone applies honey, someone prepares food, someone speaks words of comfort, someone stays awake. Maybe the person survives, maybe they do not, but the group has acted. That is what makes humans different. We do not only suffer, we respond. Before hospitals, the community was the hospital. Before pharmacies, the forest was the pharmacy. Before medical charts, there was memory. Before nurses, there were relatives. Before antibiotics, there was care. Ancient humans survived without modern medicine because they were never truly without medicine. They had knowledge built from pain. They had remedies built from plants. They had wound care built from observation. They had rituals built from belief. They had immune systems built by evolution. And most importantly, they had each other. Modern medicine is miraculous, but ancient survival was also miraculous. Because with no microscope, no germ theory, no anesthesia, no pharmacy, and no hospital bed, your ancestors still looked at sickness and refused to surrender. They tried, they watched, they remembered, they cared, and because enough of those efforts worked, enough of the time, across enough generations, you are here. You are the result of ancient bodies that healed, ancient hands that treated, and ancient communities that would not let illness face the night alone. Before hospitals, humans had each other. And for a very long time, that was the first medicine.